Hi, my name is Lorna Muthamia Ochido, and I'm making it one of my life's mission to demystify the speech therapy field and to empower more parents on what they can start to do in order to optimize their child's communication outcomes. So whether you want your child to talk more or talk better, learn better, and overall optimize their potential. So stay tuned and feel free to send in any topics on speech and language development you'd like for me to tackle. Hi, and welcome to my channel. My name is Lorna Muthamia Ochido, and today's topic is about 3 factors that will determine how quickly your child will manage their stutter. Now, the keyword here is manage, not cure, because we are ethically not supposed to ever promise any parent that we can help cure their child's stutter or help their child overcome a stutter, because stuttering is a very relapse-prone condition, which means that you can manage it and then it comes back again. If you haven't subscribed to our channel, please do, and don't forget to press the notification bell so that you can be alerted each time we publish a new video, which is usually weekly. So before we get started with the topic, kindly let me know in the comments below what you think what do you think the prognostic factors or factors that determine how quickly a child will manage their stutter are. What could those be? Any ideas? Let me know. Really curious to find out. All right, so what are the 3 factors that determine how quickly a child will manage their stutter? Factor number 1, and this is really, I think, the most important factor, so in my opinion, it's how soon that the child is able to access intervention, so quality speech therapy, compared to when the onset of the stutter was. So like last week in the clinic, I had a couple of kids who stuttered, that their parents brought them in. They're pretty young. And for both these boys, actually the parents said that the children started to stutter about 4 weeks, ago. So really 4 weeks ago, and you seek intervention 4 weeks after, that's pretty best scenario. It means because the stuttering behavior, we call it behavior or a habit. I have a video that talks about how we treat stuttering, and I explain about that it's a behavioral approach to intervention. So, and that is the reason why as soon as, or the time intervention is sought vis-a-vis the onset of the stutter is very critical, because we are saying, or we are assuming, that the behavior or the habit has not been allowed to hold, to become a very well practiced habit. It's like if you have been, I always just come up with this example. If you've been smoking for 2 years and somebody else has been smoking for perhaps 20 years, the assumption here is that the person that's been smoking for 20 years, that is a really well practiced habit. So that might take much longer than for the person that's just been smoking for 2 years. But hey, there are always exceptions to the rule. So yeah, so that's factor number 1, the age. So it's always advisable, if you suspect that your child is stuttering or stammering, really just means the same thing, that you seek out the services of a speech therapist as soon as as soon as it becomes a concern. And it's very clear when it becomes a concern. And if you're not sure whether or not your child stutters, check out our video about what stuttering is, where I talk at length about it. Yeah, so that's the first factor. Second factor that determines how quickly your child will manage their stutter is their age. So I did mention that last week the clients that I did see at the clinic were pretty young, so they were actually both 2 years. 2 years, again, is best case scenario. Why? Because the brain is rapidly developing, so whatever you teach then, it can be, whatever difficulties that they might be experiencing can be resolved rather quickly. Also because the habit has not been allowed to set, so it really is very best case scenario. But after saying that, if your child started to stutter, and this I have seen in my practice in the past, at age 8, and you came in, 2 months or a month after you noticed the stutter, that still is best case scenario, because they've not been stuttering for a very long time. Third factor that would determine how quickly your child would manage their stutter is the severity of the stutter. So what do I mean by severity? Severity is how severe the stutter is. If the stutter is mild, the assumption is that they are more likely to manage the stutter a lot quicker than if the stutter is severe. So there's mild, there's moderate, and there's severe. So a mild stutter is where they're just displaying a few of the features of stuttering, and there are many features of stuttering. I think I do talk about it in that video on what stuttering is, so please do check it out. They might just be repeating, they might just be doing one or two other things. Is it a moderate? Are they doing, you know, a few more? Are they displaying a few more of the features of stuttering? Or are they quite severe in that you can see there's a distress when it comes to, you know, verbalizing? They might sometimes, you know, even be exhibiting some what's referred to as superfluous movement. There's twitching, there's, you know, a bit of effort, you know, when the child is about to verbalize. So, but in my experience, I should just add a disclaimer here, just because I can't help myself. I have actually met children who at the onset, they did appear to be quite severe, or the stutter appeared to be quite severe. And really they came consistently. Everything else was stacked in their favor, in that they had just sought intervention very soon after the onset of the stutter. And their age was, you know, they were pretty young. And I found that really, if I'm just going by severity alone, it can be a bit misguiding, but there's all the other factors as well that help determine, okay, how quickly this child is going to manage their stutter. And I mean, like anything else, just very much dependent on what work you put in at home, whether the environment is also conducive, the skill set of your therapist as well. I do have a video that I've shot about, you know, how, what's the video? I think the video is what determines or how many therapy sessions your child needs to attend before you see progress. I mean, there are so many moving parts that you know, if you watch the video, then that will help be able to maximize on your child's progress. So thank you so much. Those are the 3 factors that determine how quickly your child who stutters will manage their stutter. I hope you enjoyed it. I hope you learned plenty. Let me know in the comment if there's anything else that you feel I have left out, but I think those 3 pretty much cover it all. There are a few more, but yeah, they do. Thank you so much, and subscribe, like us if you like the video. Thank you.